Today I'll be talking about how resistance and compliance concepts relate to congestive heart failure, or CHF. One of the major symptoms of CHF is blood pressure. It is important that blood pressure is measured in patients that are diagnosed with CHF because a spike in blood pressure can affect how well the heart can pump blood to the rest of the body. The resistance of a blood vessel affects the blood pressure. The greater the resistance of the blood, the higher the blood pressure. This is important because typically speaking, the blood vessels that are further away from the heart have a higher resistance due to their diameter and the length of the vessels. This means that in order to obtain an accurate blood pressure of the heart, the blood pressure needs to be measured as close to the heart as possible. This is why blood pressure readings are typically taken in the upper arm. As we can see from the equations from this concept, blood pressure is directly related to resistance. This means that as resistance increases, the blood pressure increases as well. It is also directly related to the flow rate. If the flow rate increases, the blood pressure increases. Compliance also affects the blood pressure. As can be seen by the graphs, if the blood pressure increases, the compliance decreases. This affects the ability of blood being able to travel to and from the heart. Overall, as the resistance increases and as the compliance decreases, the blood pressure increases, which results in a lower stroke volume. This leads to heart failure, which can occur over time as the muscles of the heart stiffen or weaken from high blood pressure or narrowed arteries. These factors are affected by the resistance and compliance of the blood vessels.